Hi, Namaskar. Today we will talk about scope of treatment or prognosis for a disease called ankylosing spondylitis. Ankylosing spondylitis is a serious chronic progressive disease which affects estimated 0.5 to 1.5% of the world population. Though ankylosing spondylitis can affect any age, we have seen that affects the younger people in early 20s and 30s more than in the later age. Of course, we have seen the exceptions of even children getting affected with this problem. It affects more males than females in general, and it requires long-term management. My name is Dr. Rajesh Shah. I am a medically trained homeopath and a director of Life Force, where we treat patients from all across the world. At Life Force, we have documented over 640 cases of ankylosing spondylitis as on today, and my thoughts shared today are based on our experience. What can homeopathy do for ankylosing spondylitis? Well, homeopathy has a very significant role to play in the treatment of ankylosing spondylitis. The treatment is essentially to bring about control or the spread or the deterioration of this disease over time. As I said, ankylosing spondylitis is a progressive disease which tends to affect joints over time, different joints, and leading to chronic inflammation, stiffness, painfulness, and immobility. So, what is very important is that to control the disease progression in such a way that over years patients should have limited or minimum deformities and inflammation and the symptoms. Homeopathy can definitely reduce the symptoms of pain, stiffness, and it can improve the mobility, and it can also reduce the drug dependency on chemical medicines to a good extent. That's what we can share based on our experience. Ankylosing spondylitis diagnosis is made by a study called HLA-B27. It's a gene that is found to be present in the patients who inherit this disease. It is called human leukocyte antigen. So this test is to be done whenever we start the treatment, and it remains positive throughout life. It doesn't become negative. What is the length of treatment? How long does the treatment require for ankylosing spondylitis? Well, in my experience, ankylosing treatment requires for a very long time. Patient may have to continue the treatment for a few years or maybe for lifelong, because it is a condition like diabetes mellitus or hypertension, which is a lifelong condition in most of the patients, if not in all. Is homeopathy recommended for ankylosing spondylitis? Yes, homeopathy is strongly recommended for the treatment of ankylosing spondylitis. Of course, besides the treatment, one requires physiotherapy and other modalities of help while ankylosing spondylitis is getting treated. I hope this video helps to patients, doctors, as well as medical students. Thank you.